So back in 2007, I was sure that I was going to be a doctor. I was dead set on medical school. I was a pre-med undergrad at Stanford, and I figured I should walk the walk in global health. And I ended up working at a clinic in rural Malawi where one doctor was trying to provide care for about 250,000 people. And patients were walking or ox carting up to 100 miles to get to the hospital to see him. And what I heard from the clinical staff was, we don't know who needs emergency care. We can't monitor danger signs for high-risk pregnancies. We don't know who has signs for tuberculosis if they're not already at the hospital. What I also found was that the hospital had recruited 500 volunteer community health workers scattered all around remote communities. And the one community health worker that I met was Dixon. He's in the middle of the photo here. And Dixon was walking 35 miles every week to hand deliver paper reports and updates on patients in his village. And I bicycled out to Dixon's village with him, and I had better cell phone reception at Dixon's house than I did in Palo Alto. And that was very specifically the aha moment for me. I described it as getting picked up off a couch and slapped across the face, and it became really clear. I put two and two together, and with a small grant from Stanford, got back to the hospital with 100 cell phones, 100 solar panels, and we went through text message training with these community health workers. And in just 6 months, the hospital had doubled the number of patients they were treating for TB. They were implementing emergency response for the very first time, and they were saving thousands of hours of travel time. It wasn't a unique situation. There are 1 billion people who will never see a doctor in their lives. And the good news that I'm here to deliver really is that other infrastructure is in place. This is a photo I took in rural Nepal in November. I spent the month hiking across mountainside, shale mountainside, 6 hours in between each village cluster. But at every cluster along the way, I had 6 bars of signal. So this is the infrastructure that we harness for our work. And I'll give an example of one of our projects. In India, where vaccination rates for children was just 60%. And our intervention was really simple. We sent text message reminders to the mothers and grandmothers of the households. And then if the children missed their appointments, we sent alerts to community health workers. And we're 13 months into this study. That vaccination coverage has jumped to 99%. So Medic Mobile is a nonprofit technology company, and what we do in a nutshell is we design new ways of delivering health services. We then build technologies that help make these systems reality. And then we work with local implementing partners to deploy the tools. In the last 3 years, we've managed 50 projects in 16 countries, mostly in East and West Africa and South Asia. We're also now working with free clinics in the United States. And by the end of the year, we'll be supporting 7,000 frontline health workers, some of the most challenging settings all over the world. And that's changing how healthcare is being delivered to 600,000 patients a year. It's a really good start, but we've looked hard at how we scale. And one of the ways we scale is through our tech strategy. We like to use what's already available in the communities. And that's meant getting really creative with these $10 very simple phones that are shipping faster than any technology in human history. We've done a lot with text messaging, but about a year ago we discovered that you could run really complex applications directly off of the SIM cards, and it works on any mobile phone on the planet. So this is a SIM app that's running on an iPhone and also a low-end Nokia. And the way that we do this is with something called a parallel SIM. And it's a little microcontroller that's thin enough to slide in underneath the existing cell phone's SIM card. So here you can see it, just a little paper-thin wafer, and we stick these into any phone on the planet and it runs our apps. So our goal, it's really ambitious, is to scale up to 400,000 frontline health workers using our tools. That means tripling our user number every year for the next 4 years, just like we have for the last 3. And the ultimate goal is to really improve health for 100 million families in underserved communities. We believe in global health equity. We've seen the power of technology, and we are really grateful for your support. Thank you.